My name is Leanne Foster. I'm a provider outreach and education specialist here at WPS Government Health Administrators. And again, I'd like to welcome you to our webinar on sole owner and sole proprietor enrollments, and hope you're doing well today. I do need to start with our disclaimer. So the material that's presented today is accurate as of today. As you know, Medicare changes often, so please always ensure that you're reviewing CMS communications, including the CMS and GHA websites, for the most up-to-date CMS rules and regulations. I will be answering questions based off of those CMS regulations today, and that is the basis for the information that's being presented today. Photographing, screenshotting, or recording of this education for profit-making purposes is strictly prohibited by CMS. I also want to make you aware that moments ago, Aileen did start recording this session, which means that you will have access to this session after today. We are recording it and it will be made available on our YouTube channel as soon as possible after today's session, usually within a couple of days. This is going to allow you to view it again for future reference, or to share it with anyone who maybe wasn't able to attend and would find this information useful. That brings us to our agenda for today. So the objective for today is to help you better understand the differences between sole owners and sole proprietor enrollments. We often get questions on these types of enrollments, and the question is usually, aren't they the same thing? And the answer is no. So today we are going to clear some of that up today. So we're going to include definitions of what a sole owner is. We're going to include definitions of what is considered a sole proprietor. This is going to include the similarities and the differences between them. And there are similarities between them. So it's not always cut and dry which one's which, but today I'm going to give you some defined lines that are going to help you identify the differences between them and their setups for their enrollment and for their provider transaction access numbers, also known as a PTAN, which is what you are sending in applications to receive from the MACs. They're different, and we will talk about that. That'll also help you further identify when you're looking at somebody who's a sole owner versus a sole proprietor. And then we're also going to talk about application submission and documentation needed for them. There are some similarities, but with submission, we are going to focus on some key questions in both the provider enrollment chain and ownership system, also known as PACOS, when you're submitting electronically through PACOS, and when you're submitting through the paper application. So we'll, again, help make these a little bit less confusing. So when a provider submits an application to enroll in private practice and they're not reassigning to a group, they don't have an employer in this particular practice, there are decisions that need to be made in regards to the structure of that private practice. And this is where we often receive questions about how they should enroll in private practice. Some believe that a private practice is a private practice and there's only one enrollment set up for this. The reality is there's actually two types of enrollment setups for providers in private practice, and that's the difference between, or that's going to be the sole owners versus the sole proprietors. They are very similar. As I stated, they're going to have those similarities. They are both in private practice, and they are both the only owner of their practice. However, one is going to generally operate under an incorporated tax ID and has a corporation that is distinct and separate from the individual, while a sole proprietor is set up under the provider's social security number or unincorporated tax ID and doesn't have a separate business entity established from that individual providers. And that's really the glaring difference between the two. And we're going to make that a little bit more evident. We're going to compare those a little bit more closely here in a minute. But one thing I do want to make really clear at this point, providers can be in private practice while still also working for an employer. This does happen. You may have someone who was working for a clinic and now they want to try and open up their own practice, but they don't really want to disassociate from their employer. They're not looking to quit that position. They want to still work for that employer while also operating their own private practice. They're going to see different patients in those two settings. They're going to be providing services separately under those two settings. And that is something that can absolutely occur. So it's not one or the other. It's not either you reassign benefits and have an employer or you have a private practice. We actually have quite a few providers that have both arrangements. So just something to keep in mind as you're working with providers or you yourself are setting up your enrollment. So to start, I want to walk you through this diagram. And this diagram outlines questions that you can ask yourself or your provider when determining if that provider needs to be enrolling as a sole owner or a sole proprietor. And the key here is really determining how they're going to be reporting Medicare payments as income to the Internal Revenue Service at the end of the year. So first you'll need to know, is the provider using a tax ID or a social security number? So that's generally when I would work with providers, that's the first question I ask. Are you going to be enrolling through a tax ID or only your social security number? Now there's a distinction here. Providers are always going to need to have their social security number on file to set up their enrollment records. However, in addition to that social security number, they can identify a tax ID. If they're telling you that they're using only their social security number and they're in private practice, so in this instance, they're not wanting to reassign benefits to an employer, they are considered unincorporated and there's no difference between themselves and their business. This does happen, usually a lot smaller clinics, somebody just practicing on their own, maybe they're doing some telehealth out of their home office, they maybe just have a small practice, a few patients. So they can do this and we can set them up with that. And we'll talk about how we set those up a little bit later. Alternatively though, if you're a sole proprietor, they may tell you that they're using a tax ID. If they tell you they are using a tax ID in addition to their social security number, there's an additional question. The additional question is, will that tax ID be incorporated or unincorporated? The difference here is that an incorporated tax ID is not issued in the provider's name. It is issued in the business's name. It might include the provider's name, but it'll usually have something like a PC, an LLC, or an SC. Those are just some examples attached to the end of it, or it's an entirely different business name. That's one of the tips that I can offer you as far as determining, even if the provider doesn't necessarily know. If they tell you that they are practicing under an unincorporated tax ID, which is a tax ID that is just the provider's name, no PC, no LLC, no SC after it, that is an unincorporated tax ID. If they're practicing under an unincorporated tax ID, it's the same scenario as if they were enrolling under their social security number only. They have a tax ID. They may have it because they themselves are going to have healthcare professionals reassign benefits to them and they want to leverage a tax ID versus their social security number for that purpose. That's the most common reason they will do that. The IRS, though, still sees no difference between the provider and the business structure. They just have a second number with which they utilize to report their income. So they're not separate. That is a sole proprietor all day long. When there is no difference between the business structure and the provider, they are what we consider, what Medicare considers, a sole proprietor. If they tell you that they are utilizing a tax ID and it is incorporated, this is going to be someone that's going to be a sole owner. They have a tax ID that establishes a separate identity. They are a separate entity from the individual provider. They are the only owner of that business, but that business has its own identity with the federal IRS. This happens, a lot of people will do this for tax Sometimes there's some tax reasons for it. Sometimes there's some legal protections with it as well. And it's a decision that the providers have to make with the assistance of their tax professional or their attorney. If a provider is truly not sure if they have a tax ID, they usually know if they have a tax ID, but sometimes they may not be sure if it's incorporated or unincorporated. They know they have a tax ID. I would encourage them to reach out to their attorney or their tax professional, whoever helped them set up that tax ID. They would be able to guide them. They could also contact the federal IRS directly, and a lot of times it'll indicate it on the documentation that they received. So next, I would like to talk about the differences in the application process for each. But first, I do want to point out that sole owners and sole proprietors have the same options for submitting the application. It's how they complete the application that's going to be different. So they will both complete a CMS 855I application, whether they do so on paper or electronically. So the image that you're seeing on the left is the login page for our provider enrollment chain and ownership system, or PACOS. This is the only method available with which to submit an application to a MAC electronically. And I can't stress enough, electronic submission is absolutely by far the most efficient way to submit these applications, not only from completion, because when you submit through PACOS, PACOS will ask you questions not all that dissimilar to some of the tax report, the income tax, income tax software that's out there. It'll ask you questions, and it'll only present to you the questions that you need based on the fact that you told the system that you are a sole owner or a sole proprietor. So it can eliminate some extra work for you. It can eliminate some of that decision making because it's going to ask you those questions, many of which I just went through. Some are some additional questions. It'll only present you with the fields. It won't let you submit the application if you're missing a field. You can also submit electronically, you can sign electronically, and you can upload your documents. And that is almost immediately into our workload, waiting for it to come up for an analyst to work. Whereas if you are completing the paper application, one of the nice things is that is available on CMS's website. It is a template. It's a PDF document that you can fill out the fields so you don't have to print it and handwrite it. However, once all of the fields are completed, you will have to print that, you will have to put that in the mail, there is going to be the postage cost, and there's going to be that time frame for that to get to the MAC. From there, the MAC has to process that mail and get that into our workload system. So right on the front end, there's sometimes a 3 to 5 day, I don't want to say delay, but a little bit of a lag because it has to get to us. Whereas it's almost instantaneous with PACOS. You submit today, we will see it tomorrow. Processing time is also significantly different. With a PACOS application, we can leverage some automations, particularly at this time with data entry. We can transfer the information that the provider or the user entered right into their enrollment record. It makes verifications a little bit easier, whereas with a paper application, it is manual entry. Processing time, any electronic applications, our processing time for what we consider a clean application, which is something that has everything we need, no development is needed, we are processing those within 15 days. And that's calendar days, not business days. Paper applications, the time frame, because of the manual processes involved, it's 30 days. So again, that's my reason for stressing electronic is the best. Paper applications cannot be faxed or emailed in. They have to be sent in regular mail. If you are newer to PACOS and that's just not something that you've delved in a little bit, I am going to ask that a link be added to the chat for a webinar that we recently did. There's an encore for PACOS Basics. I'm going to go into how you start a sole owner and a sole proprietor application today, but you might need a little bit more assistance. Again, if this is new, that particular Encore is going to include things such as how you're going to get your Paycos user ID and password, how to set up connections if you're needing to submit an application on a provider's behalf or be a surrogate for them to access their information. And then it's also going to talk about how to start some common navigate the system and start some common applications, uploading documents, signatures, all of that. So I encourage you to look at that if you haven't delved into that world of Paycos just yet. It'll be helpful. All right, so let's start with sole proprietors. So sole proprietors are going to be the only owner of the practice. And this is a similarity between sole proprietors and sole owners. They can be the only owner. So a sole proprietor cannot have a partner. The second a sole proprietor has a partner, they are no longer what we would consider a solo provider. They're maybe in a private practice, but if there's a partner, they are now establishing a group, and that is a different application. So sole proprietors, the key is solo. They have to be the only person that owns that practice or that business, if you will. As we mentioned, they're going to use their Social Security or unincorporated tax ID, but they may be filing a Schedule C 1040 form. That's another way of identifying a sole proprietor. How are they reporting their Medicare payments as income to the federal IRS? Those are, again, tips of key elements to look for to help establish that designation. Now, sole proprietor is the only owner, but that doesn't mean they can't have help running their office. So they may have managing employees. They could have an office manager. They could have billing staff. They could have employees that are reassigning benefits to them, either that will be able to bill Medicare directly and reassigning benefits to them, or maybe they're providers that aren't billing Medicare directly, but they're able to set up similarly. But in the case of office managers and billing staff, that information is going to need to be reported on their CMS 855I application. And that is because they would likely have day-to-day operational control and access to those Medicare funds. So we will be asked to ask for that information to be disclosed. So as I mentioned with their enrollment, they're going to complete the CMS 855I either electronic or on paper. Sole proprietors are only going to have one NPI, and it's going to be a type 1 NPI for an individual. They do not need to have an NPI for their business. So that's that national provider identifier. That's that 10-digit number that is utilized to actually bill. Conversely, the PTAN is the number issued by the MACs that contains the behind the scenes data, things like practice locations for a given practice setup, tax ID information, where should the checks go, bank account information, specialty information, information used to code claims and pay claims for a particular practice. So as I said, they're going to be assigned a PTAN, but they're only going to be assigned one. They have one MPI. They will only have the one MPI. They'll get one PTAN that will be under their Social Security number or a combination of the Social Security and unincorporated tax. Because the unincorporated tax does not establish a separate entity identity with the federal IRS, they can live in the same PTAN record. They do not have to be separate. So that simplifies things a little bit there. One thing I do want to point out, you may find instances where a sole proprietor would get multiple PTANs, but that is typically when they are practicing in either multiple states or in one state, but they're practicing in multiple fee localities. For pricing purposes, sometimes we have to issue a second PTAN. So any members that will reassign their benefits to the sole proprietor will receive their own PTAN, and the sole proprietor's PTAN will be set up in a way that their group members can leverage that sole proprietor as their group, if you will, as if they had an employer. So they'll leverage that as their employer. Sole proprietors, when there are members, are set up to serve both as the sole proprietor's individual PTAN, but again, also as the reassignee for any group member employees that they have. And as I mentioned earlier, sole proprietors can be in private practice and reassign benefits to an employer at the same time. So let's talk about how they are going to submit their application through PAYCOS. To start a sole proprietor application in PAYCOS, it's going to depend on a couple of things. Are they new to Medicare? Have they ever submitted an application electronically in PAYCOS? New to Medicare, they're going to be an initial enrollment all day long. They may have, they won't have any connections in PAYCOS. You won't have access to their enrollment information because they're just starting. If you have a provider who's perhaps established, maybe they have that employer set up, they may or may not be able to see their enrollment information in PAYCOS, and that's because a connection needs to be made. You can only see information for yourself or your provider when you sign into PAYCOS, when a connection has been made and there has been an electronic application in the past. It takes one for PAYCOS to kind of connect that user ID and password to that provider's enrollment information. Okay, so you may see this a little bit differently, but in both instances, you're going to want to select what you see on the left, which is the Create Initial Enrollment Application. That is going to start the questionnaire where your provider can indicate that they are a sole proprietor. So on the right, you're looking at the questionnaire that comes up. So PAYCOS is going to ask, okay, tell me about yourself. What are you trying to do? This is where it's going to know whether or not you're telling it you're a sole owner, you're a sole proprietor, you're trying to reassign benefits, group member and self-employed. That would be a situation where someone's wanting to go and be in private practice and reassign benefits at the same time. And then disregarded entity. That's a fairly rare scenario, and it's a distinction on tax documents for the providers. It would state that. But for our sole proprietor applications, you are going to select the second option, which is self-employed sole proprietor. And you'll notice under all of these, they do kind of have those key markers, some of the things that we've been talking about, and some additional things to help you understand what selecting this option means. Again, the first thing being that you are in a private practice. You're providing services in a location that you own or rent or lease. You are the only owner, and that you and your business are legally one and the same. And that is that reference to that unincorporated tax ID scenario. And it's talking about that 1040C that we're talking, or that Schedule C that we were talking about before. So by answering that question in PAYCOS, it will take you through all of the fields required to set up as a sole proprietorship. Again, one MPI and one PTAN. Now, if your provider is established and has submitted electronic applications through PAYCOS before, their screens are they're going to access this a little different. The screen's going to look a little bit different. They'd still go in through the My Associates, but they'd want to, when you're in there, if you scroll all the way down, you will see something called existing enrollments, and it's going to allow you to do multiple things for an existing enrollment, including starting an initial enrollment. So it'll show the provider's name, and if you are someone who is acting as a surrogate or on behalf of a provider, you would see any providers that you have created connections through the identity and access system there, and you'd be able to access all of their information there. So it'll show you the provider's name, it'll show you enrollment status if they have it. Again, if your provider's established, they're individual, it would say it's an 855I enrollment that's established, but you can access that. You can look at their enrollment record. Once your sole proprietor is set up, you can actually manage any reassignments that they have. It's going to allow you to revalidate if they're established, but more importantly, I want to point out the more options button. That's where you're actually going to be able to access the initial enrollment for a provider setting up a sole proprietorship for the first time. It will be, initial enrollment will be an option there. And selecting that is going to trigger the same questionnaire we just talked about, where you can make the distinction that they are a sole proprietor. So if they do a paper application, the biggest difference is going to be that they fill out section 4 a little differently. Instead of filling out section 4 for reassignments, they're now going to have to pay attention to section 4A. And I'm showing you here some images of that section. So that section is going to indicate, if you're filling out 4A, this is why. And you'll see those 4 bullets, and I have the bottom one highlighted with a red box. It is calling out the sole proprietor or sole proprietorship. It's telling you you need to do section 4A. In section 4A, which is what you are seeing on the right side, you do have a couple of choices. So they kind of combine sole owner and sole proprietorship here a little bit, but you need to indicate if you want your Medicare payments to be paid under your Social Security number. If you check that box, it's moving you on to 4B, which is going to ask about practice location information. If you're a sole proprietor and you want to be paid under your unincorporated tax ID or EIN, that's just employer identification number, you are going to check that box and then provide it. So that we make sure that that gets on the record. So this is where you would provide that. There is another section 4 that asks for tax ID, and we'll talk about that, but it's specific to sole owner. So we'll talk about that in a few minutes. So sole proprietor documentation, much the same as any provider that's enrolling, and you're going to find that it's very similar to what a sole owner needs to provide. We need licensure and certification information. Now, all of our enrolling providers are allowed to enroll as sole proprietors. This is a little bit of a change. At one time, physician assistants could not enroll as sole proprietors. With a change made last year, they actually can do that now. So all providers are eligible to do this if they so choose, but we will need licensure and certification for those. An example would be nurse practitioners. Sometimes we need their national certification. They'll also need to provide educational documentation if it's applicable. Typically our physicians, MDs and DOs, they don't need to provide that because they have a medical doctor or doctor of osteopath license. And to get that, they had to already provide that to the state. So we won't make you present it again. But again, some of our non-physician practitioners need a certain level of education that is not necessarily required by the state. For instance, as of January 1, Medicare added marriage and family therapists and mental health counselors as a specialty. They need to hold a master's or a doctoral level, and we need that educational documentation in the form of a diploma or transcript that says that they have that level of degree. So it just depends on the specialty for those two. Sole proprietors will need to provide verification from the IRS for their tax ID if they're using one. I want to be very clear, this is if they're using an unincorporated tax ID. This is not needed if they are practicing only under their Social Security number. Medicare will never ask a provider to provide a copy of their Social Security card. We have a mechanism in our PAYCO system that allows us to verify that information so that we never have to ask a provider to send that to us. It's too much of a risk. So tax document is only needed if they have an unincorporated tax ID because, again, they're a sole proprietor here. That document, if they're submitting it, has to show the legal business name and the tax ID number. We are verifying the legal name the federal IRS has in their system to avoid possible questions from the IRS about legal names matching their system and possible backup withholding of Medicare payments. So that is as much to make sure our records are correct as it is to protect you from any bumps in the road later on. Sole proprietors could also submit a CMS 460, which is a participation agreement. We'll talk about that a little bit more. Impacts sole proprietors and sole owners. So we'll talk about those forms a little bit in a few minutes. They will need to submit the CMS 588 electronic funds transfer and account verification. And this is for payments. Medicare will not make paper payments. As with the 460, we'll talk about that form a little bit more in a few minutes. So before I start with sole owners, I think this is just a good point to check in with Aileen. Aileen, do we have any questions in the chat yet?
We have not received any questions yet, Leanne. Thank you.
Great, thank you. So we'll move on to our sole owners. So they are also an individual enrolling to bill Medicare, and like the sole proprietors, they are the only owner of that business. They cannot have a partner or other owners. The second they have that, they are a group and would need to enroll using an 855B form to establish that business entity. They, like I said, no partnership, no additional owners. And that's one of the questions that we will ask. They are using an incorporated tax ID. So as I stated earlier, this is where the business has a separate identity, is recognized as a separate entity from the individual owner. So the IRS sees them as two entities. So that's the big difference there. And again, that incorporated tax ID, sometimes there are tax advantages to it, and sometimes there are legal protections that the provider is seeking with that. It's a decision, again, they need to make under the advice of their tax professional or their legal professional. Much like the sole proprietors, sole owners can have managing employees, office manager staff, billing staff. Having that staff does not mean they are not the only owner, provided that staff does not have any ownership in the business. They will need to be reported, again, because of that day-to-day operational control and potential for overseeing Medicare payments. But again, they do not constitute owners. They are managers of that office assisting that provider. And they may have employees reassigning benefits to them. Oftentimes when we see someone in private practice that is going to have medical professionals reassigning to them, we more commonly see them set up as a sole owner than a sole proprietor. But again, that is a decision that the provider needs to make for their own individual business. So their enrollment, again, they will complete just the CMS 855I, either electronically on paper. Here's where they get different. A sole owner is going to need 2 NPIs, so 2 national provider identifiers. They're going to get one for the business, which is often referred to as a type 2. And if you look at the National Plan and Provider Enumeration System, or MPES, if you've ever seen where it says what kind of MPI it is, type 1 or type 2, that's the distinction I'm talking about there. So a corporation will have a type 2, and then they themselves as an individual provider will need a type 1 MPI. And they do need to have both of them before they submit the application. If for some reason the application is submitted and it is identified that they are incorporated and we need a type 2, we won't return or reject the application to you. We will first attempt to get the information from you and we will develop. However, that can cause some processing delays, regardless of whether it's submitted paper or web. So I encourage you to ensure that those MPIs have been obtained before they enroll. When we process that application, we are going to assign 2 PTANs. We are going to assign one for the corporation, and it's going to look a lot like a medical clinic, except it'll only have one owner. And then the provider themselves will get a PTAN as a group member, reassigning to their corporation. So again, these setups look a lot like a medical clinic with members, but the difference is there's one owner. And that's generally how they'll be identified. And you'll see that if you submit electronically or have access to PACOS, you can actually see all of the enrollment information that we have on file for you, and that's how it would look. So if they have any additional members, they will reassign to that group P10, and they'll get group member numbers similar to what you see with a clinic. The difference here is that to set up this type of practice, where a clinic may need, with multiple members, will have to send in an 855B, and all of their members will have to send in an 855I, so multiple applications. With sole owners, because it's a sole owner, we can capture all of the information about the group and the individual on the 855I. They only need to do one application to accomplish a similar setup. And that's true if they submit them through PACOS or paper. PACOS will know to split that up and send it in the format that we need it. But again, the provider, to reduce that burden, only has to fill out one application. And lastly, much like the sole proprietor, a sole owner can have their own incorporated practice, their own business setup, their own group, if you will, and still be working for an employer. Again, same thing. They want to branch out, they want to start their own clinic, but they want to stay with their current employer. Maybe they're filling in, whatever that situation may be. They can work for an employer while having their own clinic. There's nothing that precludes them from doing that. So their application in PACOS is pretty similar to a sole proprietor on the front end. Same thing, if they're brand new to Medicare or they've never submitted an electronic application before, they will click the Create Initial Enrollment Application, and it will trigger the questionnaire that you see on the right. However, this time the selection they need to make will always be the first one. It'll be sole owner of a PA, which is a professional association, a PC, or an LLC. Now it can vary. We see SCs, we see PLLCs, just depends on how they set up. But they're giving the most common examples that we see with sole owners. And then again, it's asking you those questions we talked about earlier. Little different format, little different breakdown, but it's asking about those same key indicators that are going to identify the provider as a sole owner. So if your sole owner is established, meaning they have connections in PACOS, or you are working as a surrogate and you have connections to multiple providers in PACOS, same thing. You'll scroll all the way down to that first screen after you click My Associates, and you'll see the existing enrollment. Again, here you can see current enrollment information to see how they're set up, if it's time to revalidate, if they have reassignments, those can be managed from here. However, the more options button again is still key. If they are currently reassigning benefits to another clinic, they now want to set up their own practice as a sole owner, they'll do the same thing. They'll go into more options, they'll select initial enrollment, they'll answer the question, identifying themselves as a sole owner, and PACOS will present you with the fields from there, again allowing you to sign it, upload the documentation. On the paper application, again, we're back at section 4A, and it's asking some question. It's asking about business structure. So proprietary, nonprofit, and disregarded entity. Also here is indicating the form that's needed if you're a disregarded entity. And if you're trying to identify that, just another tip, generally upper right-hand corner of the IRS document will tell you what form it is. And if it's an 8832, they're a disregarded entity. If it's something like the other common ones are CP 575 and 147C, those are incorporated, and they're not, or I shouldn't say they're incorporated. Those are not disregarded entities. They may be incorporated, they may be unincorporated. But what you will see here is it'll ask the question if you're a professional corporation, proceed 4A1 and 4A2. Professional association, same thing. LLC, same thing. It's basically telling you that you are a corporation or an association or a limited liability company, and this is where you will report your tax information. And the information is structured a little different. So we're going to ask for the legal business name as it's reported to the federal IRS. As a sole owner, it is possible for your business entity to have a doing business as name. That's great, but we need the legal name. This is the name that payments will be made to. So it's super important that we have that legal business name. That is how it's going to go into our system. That's how it needs to be in our system, because our system needs to match the federal IRS so that we can avoid any bumps down the road. You'll then indicate your tax identification number. That's the incorporated tax ID from that document. Medicare ID or PTAN, if it's issued, generally it's not issued. Unless you're making some kind of a change to an existing setup of sole ownership, you're probably not going to have that PTAN, and it's okay to leave it blank if you don't have it. Or I've seen where providers will write in pending, and that's also okay. The MPI, it does tell you type 2-organizational. That is going to be a match to the language that is on the MPES system. So if you're not sure, the application is going to give you clues and tips that should help you along the way. Now you're also going to see that we need for a 2, and this is different than a sole proprietor. We are going to ask about final adverse legal actions for the business. Section 3 is where we ask for it on the individual, and on a sole proprietor, the individual and the business do not have separate identities, so Section 3 works for a sole proprietor. For a sole owner, because the business has a separate identity, we have to ask the question separately, and we do so in Section 4. So this would be any final adverse legal actions on the business. If they don't have any, you'll select no, and you'll continue on in Section 4. Again, Section 4B, where it's going to start asking about practice location information. So the documentation for a sole owner, really pretty much identical to what we need for a sole proprietor. So again, licensure and certification information as needed for that provider specialty. Again, as a reminder, all of our specialties are eligible to enroll as a sole owner if they wish to utilize an incorporated tax ID, and they can have employees. We would need educational documentation. Again, this is specific to the specialty if it's required for that provider specialty. We will need in the IRS tax ID verification. Again, it must show the legal business name and the tax ID number. It can also have the DBA, but it has to have the full legal name. One tip here is that sometimes the legal business names can get long, especially if it's utilizing the provider's name. Sometimes that's just a longer name. If their legal business name is shortened in any way on the first page of the tax document, and maybe you've seen this because we'll develop for this, it's possible the full legal name is on a second page towards the bottom of that document. We just want to make sure that it shows the full name. We are not able to accept anything that's maybe missing the last 3 letters. We have to have the first word and the last word, they have to absolutely match identically. So if you've seen development, if you had experience with these before, or even on your groups where we're developing for updated tax documentation, again, that is so that we can avoid bumps down the road, and we are trying to ensure that our records match the federal IRS. In fact, there are systematic controls in place that make it almost impossible for us to enroll the provider if we don't have that matching up on the front end. So please be careful with that. And we're going to talk about these in the next couple of minutes. But again, the CMS 460 participation agreement, if the provider wishes to be participating in Medicare, and then the CMS 588 for electronic payments. So let's take a look at those 2 forms. So the CMS 460 is the participation agreement. It is optional. And one thing that sometimes we get questions on is, well, I'm enrolled in Medicare, so I'm participating in Medicare. Being enrolled to bill Medicare and participating being a participating provider are two different things. Enrolled means that you can bill the provider. However, participating is going to mean that it's a kind of the equivalent. It's not exactly the same thing because Medicare is a benefit program, but it's kind of the equivalent of being a preferred provider in a private program. Now, again, we don't have networks. So what does being a participating provider mean, and how do those two align? Well, being a participating provider, you are accepting Medicare payment as payment in full by accepting assignment. So that means that what Medicare pays is payment in full outside of any co-pays, deductibles, or non-covered services. Okay, if you're non-participating, you are subject to a limiting charge of 115% of what Medicare allows. However, you do have that little bit of a bump. Typically, participating providers are also paid a little bit more. Their fee schedule is definitely different. So it's something that providers have to look at individually to make sure, see what makes the most sense for them. Another advantage to being participating, actually two. One, we do publish provider information so that beneficiaries and patients can find them. And then also if a claim's submitted and the beneficiary has a supplemental or a Medigap insurance, we will forward that on without you having to submit that separately. That doesn't happen with the non-participating providers. So this form, it applies to anybody who's getting paid. So group members would need to follow suit. So the employees of a sole proprietor or sole owner would have to follow suit with that sole proprietor or sole owner's decision to participate or not participate for their private practice. But this form needs to be submitted agreeing to being a participating provider in order for us to set the provider up or set their corporation up as a participating provider. It doesn't automatically happen. It's also something that at the end of each year, usually around November, providers can choose to become participating or decide to become non-participating. So you'll have an option once a year to change that information. The CMS 588, as I said, this has to do with electronic payments. This is required for all providers that are actually going to be receiving payments. Again, not group members, but the groups, providers in private practice. We will not make payment through a paper check unless there are extenuating circumstances that are generally defined by CMS. It's not an option. So we will make electronic deposits for all Medicare patients. And again, if you're new enrolling or if you're making a change, we currently don't have any providers that are receiving paper checks, but we may see changes come in for account information. So if your bank's routing number changed, that needs to be reported on this form. If you moved banks, if you changed accounts, that all needs to be reported on this form. If payments go to an account that is no longer viable, that payment will come back to us and we'll still process claims, but we won't release payments until that information is updated. It's referred to as a do not forward. So it's really important that you're leveraging this form to keep that account information up to date. Along with this document, we will need verification of the account information. So that can come in a couple of forms, either a voided check with the exclusion of a starter check. Starter checks typically are either typed or handwritten, and that's not something CMS will accept. So we do need to have an actual voided check, or if the account is too soon, you don't have actual checks yet, we understand that happens. A signed letter from that financial institution that contains all of the account information, bank name, owner name, account information, that what the type of account, whether that's a savings or a checking account, a signed letter will serve as that account verification. Though typically it does need to be less than 1 year old. Otherwise, we may ask for an updated piece of documentation. So before we stop for questions, I just want to point out that in your materials today, we do have some resources available to you. On our WPS-GHA website, I have provided a link to our provider enrollment guides and resources webpage. There's a lot of good articles. If you have questions specific to PACOs, questions specific to specialties, there's a lot of good information out there. I've also provided a link to the cms.gov Become a Provider or Supplier webpage. Same thing. There's tutorials for PACOS out there. The link for PACOS is out there. And the link to some of our manuals are out there, which is the next link. This is the Program Integrity Manual. Chapter 10 inside that manual is the manual that oversees not only the requirements for providers when submitting applications, but also the requirements from the MAC side. So there's a lot of transparency, a lot of good information in there. 10.6.4 just provides some more detailed information. I've also included links to the MPES system, PACOS, and we also have a provider enrollment decision tree out there that can help you identify a provider as a sole owner or a sole proprietor, along with other enrollment scenarios. But those questions we went through at the beginning of this are in that decision tree, and those can be helpful. All right, so with that, I'm going to check in with Aline again. Aline, do we have any questions in the chat?
Yeah, we do. We did get a question this time. And this is back when you were given the overview of sole owner. And the question is, are board members considered managing owner or partner?
That is a fantastic question. Board members typically happen when you have maybe a not-for-profit or some type of charitable organization, and those are considered kind of like an owner or a partner. If someone's trying to open a sole ownership, but they have a governing board, they're no longer really a sole ownership. At that point, they would enroll as a group using that 855B.
Great, thank you. And that is the only question that was placed in the chat today.
All right, thank you, Aline. So that does end our presentation for today. On behalf of myself, Aline, and the entire GHA Provider Outreach and Education team, I would like to thank everyone for taking the time to attend today. We look forward to your survey comments. Again, those are important to helping us guide our future educational opportunities, and we do share that with CMS. So please be sure to include any topics that you'd like to see in the future. Again, thank you, everyone. You may now disconnect.